I'm Dr. Nomori from Japan, and today I will present the cryoablation for lung cancer using liquid nitrogen. Today's issues is the first one is the procedure of cryoablation using liquid nitrogen. The second is the clinical outcome for T1N0M0 non-small cell lung cancer. The last issue is a comparison between argon gas and liquid nitrogen. Now let's get started from the first one, the procedure of cryoablation using liquid nitrogen. This is iSense 3 for using liquid nitrogen. Liquid nitrogen is put into the bottle and then set into the machine. And this is a cryoprobe and a guided system to hit the lung cancer. This is a cryoprobe, and this is a guide system which consists of guide needle, inner sheath, and outer sheath. And this guide system is necessary to hit the lung tumor because lung usually moves with respiration. So the slide shows the procedure to hit the lung tumor under CT guide. After local anesthesia, a guide needle with the inner sheath and the outer sheath is inserted into the target tumor under CT. After the inner sheath and the guide needle are removed, a cryoprobe is introduced into the outer sheath. This is a scene of cryoablation using liquid nitrogen under CT guide in Kashiwa Kosei General Hospital, which is my working hospital. And the patient is laid on the CT table, and a cryoprobe is inserted from here and connected to an iSense 3. Cryoablation is usually conducted with 3 cycles of freeze and thaw. 5-minute freeze, 10-minute thaw, 8-minute freeze, 10-minute thaw, and 80-minute freeze, and last thaw. That's which total time is 41 minutes. I will show one case. This is lung adenocarcinoma in 85 years old male. This is a primary tumor, and this CT shows during cryoablation. The cryoprobe is here, and this CT shows 4 days after cryoablation. And you can see the ablation area sufficiently covers the tumor. And this CT shows 57 months after cryoablation, showing the ablated area shrunk without recurrence. The slide shows the inclusion criteria for lung tumors. Peripheral type primary lung cancer or metastatic lung cancer, less than 3 centimeters. Definitive pathological diagnosis by CT guide needle biopsy. And third, high risk for surgical treatment or patient requesting cryoablation rather than surgery or radiation. Now, let's go to the second issue, the clinical outcome for T1N0M0 non-small cell lung cancer. Between 2013 and 2019 in Kameda Medical Center, which is my previous working hospital, 259 patients with lung cancer were treated by cryoablation. Of these, 88 patients were metastatic lung cancer, and 171 patients had primary lung cancers. Of these, stereotactic radiation therapy and cryoablation was conducted for 64 patients. This is a combination therapy. And so 107 patients were treated by cryoablation alone. Of these, 6 patients had primary lung cancers larger than 3 centimeters. And the primary lung cancer less than 3 centimeters treated by cryoablation of lung was in 101 patients. So I will present the clinical outcome of the 101 patients. These are characteristics of the patients. Median age was 73, and the tumor size were divided into quartile. Less than 0.9 centimeter was in 21 patients. Between 1.0 and 1.2 centimeter was in 29 patients. Between 1.3 and 1.7 centimeter was in 24 patients, and larger than 1.8 centimeter was in 27. Tumor histology was adenocarcinoma in 86, squamous cell carcinoma in 14, and pleomorphic carcinoma in 1. This is a complication. There was no mortality, and the pneumothorax was seen in 24 patients, but the median drainage period was just 2 days. And massive hemoptysis requiring intubation was seen in 1 patient. But for this patient, cryoablation could be completed, and the patient discharged the hospital 5 days after cryoablation. And mild interstitial pneumonia was seen in 1 patient. And median hospitalization was 5 days. The slide shows the local recurrence-free period in each tumor size. Median follow-up period was 21 months. Blue line shows less than 0.9 centimeter. Red line shows 1.0 to 1.2. And green line shows from 1.3 to 1.7 centimeter. And orange line shows larger than 1.8 centimeter. As you can see, none of the tumors less than 1.8 centimeter experienced local recurrence. But 9 of the 27 tumors larger than 1.8 centimeter experienced local recurrence. This is the characteristics of patients, 9 patients who suffered local recurrence. This line shows the tumor size. The smallest tumor was 1.9 centimeter. This line shows the local recurrence, the time of local recurrence after cryoablation. While 1 patient recurred 48 months after cryoablation, the other 8 recurred within 2 years. This line shows additional treatment for recurrence, local recurrence. Cryoablation was conducted for 2 patients, and the combination of SRT and cryoablation was conducted for 4 patients, and the surgery for 1 patient, and no treatment for 2 patients. And while 1 patient was died of the lung cancer 19 months after cryoablation, but the other 8 are alive. This slide shows the characteristics of 7 patients who suffered distant recurrence. This line shows the tumor size. 3 patients had tumors less than 1.8 centimeter. And this line shows the recurrence site: brain and bone, lung, lymph node, trachea and bronchus, adrenal gland, pleura, and the lymph node and local. The slide shows the recurrence-free survival of each tumor size: 0.9, less than 0.9, And the red line shows the 1.0 to 1.2. Green line shows 1.3 to 1.7. And the orange line is larger than 1.8. And as you can see, this is a 3 years line, 3 years line. And as you can see, tumors less than 1.8 centimeter, 3 years recurrence-free survival was 84%. On the other hand, tumors larger than 1 centimeter, it was 44%. The slide shows a percent change of pulmonary function after 6 months. It was 98%. Okay. I have 15 minutes. And the decrease of pulmonary function was little after cryoablation. So short summary, main complication with cryoablation was pneumothorax. The cryoablation would be one of choice for lung cancer less than 1.8 centimeter. For lung cancers larger than 1.8 centimeter, 2 cryoprobes would be necessary. The last is a cryoablation would not decrease pulmonary function. And the last issue is a comparison between argon gas and liquid nitrogen. From 2002 and 2012 in Keio University Hospital, my previous working hospital, I conducted cryoablation by using argon gas. Between 2013 and 2019, in Kameda Medical Center, as I showed you now, I conducted cryoablation by using liquid nitrogen. Therefore, I can compare between the two. This is a system using argon gas cryocare and argon gas and helium gas. And these gas cylinders have to be fixed in the CT room, which makes it unavailable in other than CT room. So between 2002 and 2012, 193 patients with 238 tumors were treated by using argon gas. 22 tumors were primary lung cancer, and 216 tumors were metastatic lung cancer. This is the overall survival. 1 year survival was 85%, 2 years was 64%, and 3 year survival was 52%. Okay. So this is a liquid ice ball in pig lung using liquid nitrogen. This is a liquid nitrogen, but if you use argon gas, at the end of the freeze, third freeze, it was just 1.8 centimeter. Ablated area by argon gas is smaller than that by liquid nitrogen. That is the reason why the argon gas system usually needs more than 2 cryoprobes for lung tumors. And this is temperature I pass. And this is expandables cost. Argon gas is okay. So it's more higher than liquid nitrogen. So that's the end. Thank you.